Hey there, Dr. Luke here. We're going to do some spinal segmentation work for the lower lumbar spine. Really important, the foundation of spinal health, getting individual movement and segmental range in flexion and extension. We are going to need some yoga blocks, a band, if you do have one, and an exercise ball. But if you don't have one, you can do this class without it. So let's give it a go. Okay, controlled articular rotation for our spine. Let's breathe in and irradiate. We're going to go into flexion, rotation, lateral bending, and extension. Keep extending, rotating, lateral bending, rotation, come into flexion. Let's do that again, to the right, extending, rotating, lateral bending, slow and controlled. Find that workspace. Best possible rotation that you can get, and final one for this side. Coming back into our neutral position. Okay, let's go to the left. Let's flex, rotate, lateral bend, extend, rotate, lateral bend, rotate and flex. Explore that best possible range in that pain-free range. Good, last one, really explore that best possible range. Great, and into that neutral position. Fantastic. Okay, let's start off with our spinal segmentations, our cat-cow. On all fours, we breathe in and irradiate, really get into deep extension, pain-free range though. Now we want to just get some general flexion and extension in our spine first of all. Just get a feel of coordinating that movement, that wave that we get throughout the spine when we're doing this movement. Okay, start off in extension, breathe in and irradiate. We want to initiate from that lower pelvis. We want to go into posterior pelvic tilt, slowly and controlled. Posterior pelvic tilt, just focus the movement on the pelvis, coming up to our lower lumbar spine, upper lumbar spine now, thoracic, pushing our thoracics up into flexion, bringing our neck down and squeezing up. I like to look at my knees here, squeezing up into flexion. Excellent. Let's go into extension, initiating from that lower pelvis into anterior pelvic tilt. Slow and controlled, go deep into extension there. And now we go up the spine to our thoracics. And into our neck, looking up, extending, squeezing out that extension. Now we're coming back, initiating from our pelvis into posterior pelvic tilt. Extending, slow and controlled, up through our thoracic area, and down, pushing up into flexion, slow and controlled, initiating from our pelvis again, anterior pelvic tilt, Now into extension. One more rep there, slow and controlled. Focusing one segment at a time. Great, now back down into extension. Fantastic. Now what we want to do is grab a yoga ball. We're going to use this yoga ball up against a wall. We're going to place the yoga ball on our sit bones. This is going to give us some neurological feedback of where we're at with our spinal segmentation. Just push gently up against the ball with your sit bones and then breathe in and irradiate, start in extension. And then we're moving the ball up and down, but I only want you to focus on your lumbar spine here. Really slow and controlled, and you'll feel your sit bones moving the yoga ball up and down. Gives you that neurological feedback that's very helpful in coordinating this movement. Okay, another 4 reps. 1, 2, 3, and 4. Great. Now what we want to do is side bend. So we're going to bring our hip to our ribs and laterally flexing to one side. So let's do a side bend. What you'll feel is you'll feel your sit bones move that yoga ball or exercise ball from one sit bone to the other. And last rep. Okay, segmentation in the bridge position. Laying on our back, arms by our sides, we breathe in and irradiate. We go into posterior pelvic tilt, and then we're going to then move one segment at a time into the bridge position. One segment at a time, maintaining posterior pelvic tilt. And while maintaining that pelvic tilt, we want to go back down one segment at a time and maintaining posterior pelvic tilt, feeling one vertebra go down at a time, coming down and into anterior pelvic tilt, back into posterior pelvic tilt, and then one vertebra at a time, peeling off the ground into that bridge position. Good, maintaining posterior pelvic tilt, one segment at a time, going down into anterior pelvic tilt. It's really important that you maintain posterior pelvic tilt while we're going down and letting one vertebra at a time segment down to our pelvis and then go into anterior pelvic tilt. This is all helping to retrain that flexion and extension for a healthy movement of the spine. Let's do one more. Let's let this be the best rep ever. Nice and slow and controlled. Coming down one segment at a time. Good, and into anterior pelvic tilt. Great, well done. Okay, we're going to do some hinge point work. We're struggling with areas of our spine that don't move individually, but they move in a group in flexion and extension. We want individual control in flexion and extension. So find an area that you're struggling with. I'm going to be looking or placing this at the bottom of my lumbar spine, L5, L4 area. We're going to place some tension around that. The band is going to create some neural input to where I need to be pushing in flexion and extension. So breathe in and irradiate, create some body tension, come to the edge of the chair, and then we're just pushing into that band. We're finding our end range and squeezing out into as much flexion and then as much extension as we can. So these need to be really slow and controlled. Try and only move the lumbar spine, focusing mainly on that lumbar spine. Last rep, and then we're going to move to a different section of our lumbar spine. Great, I'm going to come this way. I'm going to come a little bit up through into my L2, L3 area. Start off in extension, and then we go into posterior pelvic tilt. Pushing out where that band's pressing up against your spine. And last rep, posterior pelvic tilt, we're going into flexion, pushing out to the end range of flexion, and then slow and controlled, coming into the end range of extension. Great, so just alter the amount of reps that you do there, but get into that really, really important. So we're using some neurological input to help us get that flexion extension of those areas of your spine that you're struggling with.